So tell me, how's your research coming along?
Really well, actually. I think we've made significant progress these past few months.
How long until we're ready for phase 1 human trials?
I'm not sure. I think it should be fairly soon. It's been really tricky, though. The strain's been resistant to most of the previous tests we've conducted, but thankfully we've had a breakthrough. All the mice have been getting better lately.
Good. I don't mean to pressure you, but the sooner we move forward with this, the better it'll be for everyone. We can't afford to wait around too long. Putting this on the market within the decade is the kind of break this company needs.
I understand. Don't worry, it's been a long time coming, but I'm sure it'll be ready to move forward soon.
I know it's been stressful around here lately. I'm sorry about that. How are you doing?
I'm fine.
What about your dad? Is he doing okay?
He's hanging in there, for now. Hey, how about a game of chess? I've always noticed that board over there. It would be a nice distraction.
You know, I don't think I've touched that set in years. I used to love playing it.
Well, come on then. It'll be fun.
Sure, why not? Dr. O'Connor, is everything all right?
It's just, I know we're in phase 2 already. I just can't help but to think that there's more to do.
Look, Jessie, I know you've been working on this for years. You've done a great job. Don't forget that. If your dedication to your research continues, I know you'll have a very successful career.
How are the clinical trials going? I heard one of the patients died. What if this isn't ready?
That's just one person. These things happen. That's why we're doing this. Luckily, the others are very promising. We just have to monitor the dosages and side effects. Don't worry. This will work. Well, I have to go visit Mr. Hugo now.
Maybe I should research a cure for the feeling you get after meeting with him.
Keep up the good work. Hi, honey. How's everything going? Did Jack take his medicine? Tell him I'm sorry I can't be there. Does he look better today? That's great. Oh, I'm fine. Just busy. Just a lot of work lately. More than usual. By the way, I know you're tired of hearing this from me, but did you apply for the job at that school? What about that interview you had last week? Have you heard back from them? Okay, I'm sorry. I'll stop asking. I have to go. See you tonight, but I might be late. Bye.
Ah, Dr. Belvach, just the one I wanted to see.
What can I help you with, Mr. Hugo?
Artie, remember? Mr. Hugo's boring.
Okay, Artie. Did you have something you wanted to talk to me about?
Yes. I just met with the board. I'm afraid I have some bad news.
What's wrong?
Well, first of all, Anne, don't tell anybody I'm telling you this. I don't want anyone to panic. But Onata's Pharmaceuticals is suffering. I know we're new and can't be expected to rank in the billions like the other multinationals, but we also can't afford to sit around and do nothing.
What do you mean? What's wrong? We've been testing 9 new drugs with promising results.
We've been testing with promising results for a long time now. We need actual results and we need to market them soon. These trials are expensive. We're already in the hole about $100,000, and that doesn't even include the marketing costs.
Well, I'm sorry, sir, but you know we can't throw them out to the public without FDA approval.
Look, we're losing investors and our stock prices are plummeting. We need to make an impact. As a subsidiary, this company could be sold and you and I could both be out of a job.
Do you really think they would do that?
We're afraid it might. I know you've been overseeing the research on the parasitic disease, So I called you in here today to see where you're at with it.
Well, our clinical trials for toxoplasmosis are moving forward quite well. The drug Dr. O'Connor developed has exhibited positive results, with only minor side effects in phase 2.
This company isn't doing too well, and I know your son isn't doing too well either. We all need this. Curing a couple people in Asia isn't going to help us much. The investors don't give a damn about the rest of the world unless the rest of the world pays them to give a damn. That's the way it is. If you think this drug can keep us afloat, then see to it that we put it out as quickly as possible. But I want to make sure the other drugs are proceeding at a good pace too. I don't think toxoplasmosis will be enough. Ah, you must be Mr. Barton.
Please, call me Matthew.
Only if you call me Artie. Now what can I help you with, Matt? I've read some of your work and you're a talented writer. The world could use more journalists like you.
Well, thanks. I'm actually here for another article I'm working on.
Oh yeah?
I just returned from China a few weeks ago. As you know, toxoplasmosis is devastating rural areas over there. It's starting to spread to Southeast Asia, and over 1,000 people have died from it this year alone.
It's awful, isn't it? And I'm sure you know we've been working non-stop to try and bring a cure to those poor people. In fact, I was just talking with one of my doctors today about the clinical trials, and she's positive that the drug we've been working on might be marketable fairly soon.
That's actually why I'm here. I was interested in interviewing you and maybe someone involved in the development of the drug. I'm looking to spread the word. Open some eyes?
Oh, absolutely. Let me first say on the record that Onatos Pharmaceuticals is proud to be at the forefront of making sure that this drug can harm fewer and fewer people in the world. That is our duty and our primary focus. I want to eradicate it and render it a thing of the past.
And what can you tell me about the parasite itself? Or the work that you do for that matter? Sure, it's deadly, but how is it that your drug is able to cure it? And when can people finally expect a cure?
Why don't I leave you with the woman that led the development of our drug? Dr. O'Connor here is one of the best and probably could tell you more than I ever could. Be positive. Remember, good press is good for the company.
Hi, I'm Matthew Barton. I'm a freelance journalist. Lately, I've been working on a piece on toxoplasmosis. I suppose you're the go-to person for more information on it?
Barton. Sounds familiar. I may have read some of your articles before.
Maybe you did. My work appears in a lot of different places. Not to brag or anything.
Oh yeah? My work will save lives. Not to brag or anything.
Well, at least mine doesn't cause headaches, diarrhea, and vomiting.
That's debatable.
Ouch. Well, listen. Obviously, you know how deadly this parasite's been. Can you tell me more about it or what it's been like working on it?
Well, Toxoplasma cerebrum 1 has been an irritating specimen for sure. Not only has it been resistant to existing treatments for parasites, but we soon realized it started mutating in Stanter.
In Stanter?
Quickly. It started evolving quickly. But thankfully, we've been able to isolate the evolved forms, and we think we've been able to create an effective treatment for TC1, the naturally occurring specimen that's been doing a lot of damage in China and elsewhere.
Wait, so it evolved? I haven't heard that one before.
Fortunately, that strain only exists in laboratories as far as we know, which is probably why you didn't hear about it in China. Our clinical trials over there seem to be effective in treating TC1, so we assume it hasn't evolved there. Either way, we're still doing more to develop drugs for this new form, which is a bit tougher and already seems pretty resistant to Trictosec, the drug we already made for the original one. I'm hoping to find a complete cure, but it's already developed drug-resistant properties once, so I can't say for sure if it'll happen again.
And what would you do if that happened?
My job.
My time's just about up. But why don't you and I get together tomorrow night and we can discuss this further over dinner?
No thanks. I have important work to do. Sorry.
Oh, come on. I think you'd make a great focal point for the article. Certainly have been for me. Okay. That's fine. Thank you for your time.
Hey, Danny. I'm fine. It's just been a long day. Is Jack asleep? Good. Did you pick up his refills? Okay. Bye.
Hey, Anne. What are you still doing here?
Just one of those nights. Lots of paperwork.
Surprised your hand hasn't fallen off yet?
Yeah, well, at least it's overtime. Anything helps.
Definitely. How's Jack doing?
He's as good as he can be at this point.
Okay, well, go home, Anne. Get some rest. I'll see you tomorrow.
Centers for Disease Control have been called in to look into the local spread of toxopneurosis, a parasitic disease caused by the TC1 parasite, usually transmitted through tainted foods or liquids. Hospitals have currently admitted and diagnosed 108 patients with it so far, but they fear that number may grow. Officials believe that it spread from contaminated food flown to a local airport 3 weeks ago from China, where the parasite and disease originated. These are the first known cases of the disease in the United States. Currently, there are no available cures, and it is considered terminal. However, health officials are urging the public to remain calm. Stores have already taken potentially dangerous foods off their shelves.
You saw the news, right? How did this happen?
Someone must have been careless when coming back from the States. It's not like diseases don't spread every day.
This just feels off.
Don't be crazy. There's no way this is our fault. They already said it was the food.
I didn't say this was our fault. Shouldn't have spent so long researching a cure. We could have been to market and had a treatment. All these people wouldn't be dying.
You can't blame yourself. These things take years and years to make. There's nothing you could have done differently to stop this. Besides, we're close to phase 3. We can help them if we include them in our trials. Your drug is working. You're going to save so many lives. Your dad will be proud.
There has to be more to this.
Come on, Jesse. Calm down. You're going to go insane looking for something that isn't there. Stop being paranoid and get to work. What's wrong?
These numbers are off.
You've been working a lot of late nights. Mistakes happen.
No, these are inconsistent. I know something is missing.
This looks fine to me. Nobody will notice anything wrong with this. It looks normal.
Shouldn't you be concerned about this?
I would be if it was tampered with. Nothing looks drastically different here.
It's not drastically different, but it is different. We should tell someone about this.
No. We don't want to appear negligent or anything. This is the kind of thing that could cost us our jobs. Do you want that to happen?
No,
I don't want to risk it.
it doesn't make any sense though. Look at that date. I was here late that night, and I wouldn't write anything like that down. You were here too.
I don't think I was.
I'm pretty sure you were.
Jesse, stop. You're making things up.
Anne.
Dr. O'Connor, you work for me. I don't appreciate you coming in here and accusing me of things I had nothing to do with. This disease got here on its own. You're not responsible. I'm not responsible. Nobody is responsible. Understand?
I wasn't accusing. If you didn't hear from Artie, there's a press conference tomorrow, and he would like to see you. So be there.
Mr. Hugo.
Artie.
Artie, have you seen Dr. Belvach around?
She told me that her son was having some complications, so I told her to take a couple days off. Poor kid. Now, Dr. O'Connor, stand next to me, smile, and let's make sure that these people know what great work we've done. It's awful that this disease made its way to this country, but the good news is that this press conference is going to make us look great. So let's do it. Thank you, everyone, for being here. I called this press conference today, as you may have guessed, in response to the recent outbreak of toxonoriasis in the United States caused by the unexpected spread of TC1. Here at Onados Pharmaceuticals, we are glad the CDC, WHO, and other health officials are starting to bring greater cooperation and awareness to this devastating parasitic disease. They have our full support and cooperation and eradicating it. For over a decade, our researchers have been tirelessly studying this parasite and disease which has been responsible for far too many deaths, over 1,000 this year alone. Now that it has come to America, it is more important than ever that we find our way to prevent it from harming anyone else and spreading even further. Thanks to our intelligent scientists, including Dr. Jesse O'Connor here, who helped create our new drug, Trictoset, we have been leading the charge in developing effective and safe options for treating this. Our human trials in recent years have been incredibly successful. I am happy to announce our plans to move forward with Phase 3, clinical trials. In doing so, we hope to have the FDA approve our drug by the end of the year and make it available to patients worldwide. Soon, Onados Pharmaceuticals will make toxonoriasis a curable condition that will not be able to harm anyone anymore. Thank you.
Wait, Mr. Hugo, how will this go to the general public? When will this be available to the public itself? How does this coincide with Medicare, though?
Anne, where are you? I need to know what is going on. Call me as soon as you get this.
That was wonderful. Exactly what we needed. We're already getting more investors, and I'm pretty sure I saw some major networks out there.
Do you really think the drug is going to be approved by next year? Trials should really go on for another year or two.
Don't worry. Trictoset is perfectly safe. The previous trials prove that. A few more months, we'll be fine. We probably don't even have enough in the budget for a few more years anyway. The sooner we can get this out, the better. It's now or never. Just remember, not only are you going to save lives, you're also going to put this company on the map.
Oh, hi. I didn't know you'd be here.
Why wouldn't I be? I'm a journalist covering TC1 and the disease, remember?
Still working on that, huh?
You can't rush these things. Besides, you of all people should understand taking your time.
I suppose. You know, I was just about to head to the cafeteria for some lunch. Would you like to join me?
Are you sure about that? I thought I made you nauseous.
Well, that's just your articles. Anne, where are you? I need to know what is going on. Call me as soon as you get this.
Seriously, my first time leaving the States to do some investigative journalism on developing third world countries, and I forgot to pack my underwear. It was the worst week of my life.
I believe you. In fact, I think I can still smell it.
Oh, no, that's just because I got so used to it. I've been wearing the same pair ever since.
Oh, you really know how to charm a woman.
So, tell me about yourself. What got you into this line of work?
My dad. I wanted to help him.
Well, what about TC1's sudden appearance in America? That's pretty strange, right?
It's pretty terrible, but Trictoset should be close to being put on the market, so that should help. Can we talk about something else, though? Work talk is boring.
Oh, no, it's interesting. Do you think the drug will cure the disease completely, or do you think it'll just mutate again like it did in your lab?
I don't know. I hope it doesn't. But I'm tired of talking about parasites and drugs. I thought this was my lunch break.
Well, what about the fast spread of it? Is that natural or unexpected? Fine. You know, I should probably be going anyways. What about later tonight?
What about it?
Do you have any plans?
I don't think so.
Well, why don't we grab a drink?
Sure.
Great. I'll call you. Well, what about TC1's sudden appearance in America? That's pretty strange, right?
It's pretty terrible, but Trictosec should be close to being put on the market, so that should help. Can we talk about something else, though? Work talk is boring.
Where are you going?
Jesus, you scared me. I didn't know this was your car. What happened last night?
I don't even remember. I think I must have been too drunk to drive.
How considerate of you.
I am a responsible alcoholic.
What time is it? I have to get to work.
Then let us depart.
What are you doing with him?
There you are. Thank you for returning my call.
You realize he's just being nice to you to get dirt for his ridiculous article.
You, of all people, do not have the right to question me.
Are you really still stuck on that?
You are the only one that had access to my lab.
It is not your lab and it is not your inventory. Don't mistake me, Dr. O'Connor. It is my lab.
Anne, I thought we were friends. You don't have to hide anything from me.
I'm your superior. You have no right to question me, especially when you're insinuating that I infected all of those people. How could you think I would do something like that?
You think I want that to be true?
Stop dwelling, you're gonna drive yourself crazy. Be careful what you say to that Barton guy. I don't think...
What do you think? Have you even met him before?
I know what kind of person he is. Just be careful. What's wrong? You okay?
I'm fine.
Well, I have a mountain of paperwork to get to. I'll see you later.
Paperwork. Okay.
Maybe you should try looking for a different job.
Why?
I don't know, lately you seem really depressed. I'm out of touch.
I've just been really busy at work. We're moving forward with the new drug testing. That's all. I'm fine.
Okay. Hey, I got an interview on Tuesday for that teaching position.
That's great.
Yeah, I think I got a good chance at it.
I know you'll get this one.
I hope so. I mean, I know it won't bring in much, but I can help out for a change, you know? I'm going to bed.
I'll be up in a minute. Sorry to interrupt. What are you doing here?
I just came for lunch.
I'm beginning to think you work here as well. Anyway, I just wanted to apologize for my short temper before. I'm actually gonna go get some coffee, so can I get some for you too?
Sure.
Sure, thank you.
Is everything all right?
Yeah, she just seems different all of a sudden.
Different how?
I can't.
Can't what?
Nothing. Just forget about it.
Great, so now you don't want to talk.
What do you mean?
Oh, no, it's just, I was joking. All right, you were pretty talkative at the bar is all.
What did I talk about?
Honestly, I can't remember.
Here you go.
Thanks.
Thank you.
Listen, Jesse, I gotta get out of here. Have a meeting with health officials, you know, the usual stuff. But I'll see you tonight.
Yeah, of course. See
Great.
ya.
See ya.
Why are you being so nice all of a sudden? I thought you hated him for some reason.
I told you I was sorry.
A cup of coffee isn't going to fix all the stuff that's been going on lately.
I told you I don't know what's going on. Look, I'm trying to be nice. Can we drop it already?
Somehow, I just don't believe it.
Well, apparently I can't convince you otherwise.
Hey, it's me. I'm really sorry, but I might have to cancel tonight. It's nothing big. I just feel a little out of it right now. I think I just need the night to rest. I'll call you first thing tomorrow. Bye.
Hey Matt, it's Jess. Just wanted to know when we can reschedule our date. Want to know if you're feeling better. Just give me a call back. Look forward to hearing from you. All right, bye. Hey Matt, it's Jess. Just wanted to know how you're feeling. I haven't heard anything from you yet. Just give me a call, okay? I want to know what's going on. Bye. Matt, I haven't heard from you in days. I'm getting really worried. Let me know how you're feeling. Call me, text me, something. Okay, bye.
Dr. O'Connor, I need to see your lab results as soon.
Hello? Where are you? What happened? Are you okay? I'm on my way.
What's wrong?
Matthew's in the hospital.
What happened?
I'm not sure. I have to go there and figure it out. He sounds really sick. Can you drive me?
Sure.
Now. Are you okay?
I don't know. They're running tests, but they won't tell me anything, and I think I know why.
It can't be that. It's happening way too fast.
I've seen it before. I've seen people with it. I've seen too many people die from it.
That's not it. That usually takes weeks or months. It's been, what, a few days? It can't.
I don't know. You're the scientist. You tell me.
Even if it was, how could it have infected you?
There's something I have to tell you.
What do you mean?
At first, I was just looking to get more information for my article. I figured I'd get good info out of you if I just played nice. I'm so sorry. I shouldn't have done it. It was stupid of me. But I really did start to like you. Then we were out at the bar, and you told me you thought Belvoc might be responsible for spreading the parasite in America. I wanted to dig deeper, so...
Matthew, I was drunk. I don't even remember what I was talking about. I don't even know what I was talking about. Yeah, there was something strange with the paperwork, but I must have been paranoid or something.
What if you weren't being paranoid?
I don't think she would do that.
You don't sound so sure.
So what? She infected you? Why? And how?
I don't know. But she has access to your lab.
Yeah, but...
Listen, I hope it's not true. But what if it is? Do you think I could get a dose of that lovely trichticet of yours?
Yeah. Maybe, but then you'd have to volunteer for a clinical trial, and that could take a while. And your symptoms have progressed so quickly. This doesn't make sense.
Unless what?
Well, I told you about the mutated strain, TC2. Well, we were doing clinical tests on animals, and the animals would deteriorate quicker and quicker, and their symptoms would get worse and worse. Sometimes they would deteriorate within hours.
If it's the mutated parasite, then it has to have been her.
That means the trichticet wouldn't work.
Your wind-up girl is going to burn out. It's the last crooked mile I will walk for you. It's the last dirty joke to make you smile. Too many times I held you up. I spread flowers beneath you through the history that you'd write and rewrite. Here is our hero. Here is our hero.
While the number of infected people remains in the low 100s, so far 26 people have died from the toxonoriasis outbreak. The most recent death is that of journalist Matthew Barton, who had recently been traveling to China to research the TC1 parasite and disease. He had previously appeared on this program to discuss his findings. The FDA is currently testing Trictoset, a new drug that has exhibited
awful, isn't
positive
it?
results in
To
treating
think he was just here.
toxopnoriasis. A
Poor
spokesperson.
guy. I gave him some good quotes to that article, too. Hey, how's Dr. O'Connor taking it? I know they were pretty close. I hope she didn't divulge anything too secret about us.
Yes, it's very sad. I haven't seen Jessie or Dr. O'Connor all day. Fairly certain she wouldn't say anything like that.
Well, from this tragedy, I do have some good news. Our stocks have been going up, and many of the infected people have been approved to be in clinical trials. So that saves us some money. I don't think we're going to be sold either, at least not yet.
Really? That's a relief. Well, I should probably go back to my work.
What the hell did you do?
Jessie, you don't understand.
How on earth could you even think of doing this?
You know, this company was close to being sold off and shut down. How would I support my family?
But what about all those other people? 100 infected, over a dozen dead. Matthew, we had time.
No, we didn't. Our backers were pulling out. We're this close. Thousands will survive because of this. Because of us.
But more will die. More are dying.
How many were dying already? No one even noticed outside of you and me. Your drug is going to go through sooner than expected. We're going to save thousands of lives sooner. No one cared, Jessie. They never do. No one cares enough to help until the problem arrives at home.
That doesn't even come close to justifying what you've done.
It was the right thing to do. This will help people.
It didn't help Matthew.
I had to protect us, and he was going to figure it out. I couldn't risk it.
He was going to stop. He was actually interested in me. God, for once, someone was actually interested in me. I could have started a life outside of this goddamn company, and you ruined that.
I don't expect you to forgive me, Jessie, but you can't tell anyone.
How could I not tell anyone? People need to know about this.
If you did, they'll investigate and find your inventory tampered with your signatures on the paper. You were the one everyone saw getting close to Matthew. You were the one handling TC2, and he's the only one who died from it. It wouldn't take long for them to link the mutated parasite to you. There's nothing to prove I did anything.
Like you said, it's your lab, and they'll find something linking you to it. I had no motive.
Maybe. But it's enough to make people question you, too. It could end up ruining both of us. No more people have to die, Jessie. Our trials will help the ones already infected. The company will survive, and so will everyone else. Trictoset is going to be marketed within months. You'll be recognized for it. It's over.
Hey, Jesse. It's been a while. How have you been?
Fine.
Hard to believe you're leaving. You've been here almost as long as Anne has. Wherever you go, though, they'll be lucky to have you. Right, honey?
Yes, very lucky. Jesse's been one of our best researchers and a great friend.
Thank you. How is Jack doing, by the way?
He's doing better. Thanks for asking. It's nice to get a babysitter for once, though. Two of us enjoy an evening out together.
I'm so glad to hear that. I hope he stays healthy. He's such a great kid. I can't help but to think of all the people who lost someone important to them before he could get the drug out. Can you imagine?
I can't. It's my worst fear in the world. Though the doctors have been incredibly optimistic.
That's wonderful. It's nice to know that the money this company makes will help at least one family.
I'll go get us some drinks.
Can I have everyone's attention? I would just like to say thank you, Dr. O'Connor, for all of the dedicated work that you've put in over these last few years. Not only have you helped give this company a voice, but you have literally saved countless lives. To Dr. O'Connor.
Dr. O'Connor.
I would also like to toast to Jessie. She's smart, independent, and determined. Without her, a lot of us wouldn't be here today. In fact, as Artie put it, a lot of people wouldn't be here today. It's no secret Jessie has been a great employee over the years, but I cannot begin to touch upon how great of a friend she has been as well. Jessie, your loyalty and dedication would make your father proud. Thank you for all of your hard work. We'll miss you. Cheers.
That was a great game.
Yes, it was. Thanks for suggesting it. It's nice to focus on something else for a change.
Tell me about it. I need to get back to work, though. We'll have to play again sometime.
Absolutely. I'm sure we will.
Federal authorities, with the help of the CDC, have reopened their investigation regarding the introduction of toxoplasmosis into the United States. 2 victims of the disease were discovered to have been infected and killed by a mutated form of the TC1 parasite, known as TC2, which is immune to the recently FDA-approved Trictoset. Representatives from Onato's Pharmaceuticals, the only place in the country where the TC2 parasite was housed and researched at the time of the outbreak, have denied any allegations that the company is responsible and promised to work with the FBI in its investigation.